Good evening, everyone. A warm welcome to our National Trainee Engagement Forum Insight event on Greener NHS and Sustainability. Thank you for joining us today. My name is Radha, and alongside my colleague Venetia, who you'll meet shortly, we're the Junior Doctors and National Medical Directors Clinical Fellows at Health Education England, and we're delighted to host this webinar on behalf of HEE. This event will be recorded for those unable to join live and will be made available via the HEE National Trainee Engagement Forum or NTEF webpage and YouTube channel. The Q&A function is open for any comments or questions, and we'll try to get to these if we have time. I'll now hand over to my co-host Venetia to take you through the event.
Thank you, Radha, and good evening to you all. The agenda for the next hour will include presentations from our fantastic speakers. Dr. Nick Watts, Chief Sustainability Officer of the NHS, and Dr. Tim Ferris, National Director of Transformation at NHS England and Improvement. This will be followed by a Q&A session with a panel of 3 fellows working in this area. The event will be closed by Professor Wendy Reid, Director of Education and Quality and Medical Director at HEE. We are now delighted to introduce you to the Chief Executive of HEE, Dr. Navina Evans, for some opening remarks.
Good evening, everybody. Thank you so much for giving me the opportunity to say a few words at the start of what is going to be a really interesting event, and well done to our fellows for organising this. So this is such an important topic, and I am really pleased to be able to say a few words at the start here. Once again, well done to the organisers for setting up this event, and thank you so much to our speakers for giving us your evening here at HEE. Sustainability is everybody's business. It's such an important thing, and it's so good to make sure that we play our part. It's the right thing to do. It's the healthy thing to do. It leads to improved quality of life for all the people that we serve. It's closely linked to tackling health inequalities. It helps us to make sure we think about addressing the social determinants of health. It's so closely linked to your personal, social, and your working lives. So when I spent a little bit of time reflecting on why this matters so much to all of you right now, as you are at this stages of your career, thinking about what you do now, how it's going to impact on the future, but more importantly, how you will be working and leading in health and care of the future. As you know, in HEE, we're heavily involved in education training and future workforce planning. So I'm always thinking about what's going to happen in 10 years, 15 years time and beyond. And you all are going to be so critical to that work and to making sure that you lead in the future and for the future. So you will have the immense power. I'm not sure you realize how much power you will have right now and way into the future to make change happen, and to make change happen in so many different ways, not just the direct impact of your clinical roles or your managerial roles or your educational roles, whatever you end up doing in health and care. You will have a really important role to play in your communities. I really hope that you understand that as professionals, health and care professionals, you're not just there to do your one job, you're there to do a whole host of jobs to serve your communities. So with that in mind, use this power that you have wisely. And I hope that you will really embrace this really important issue as you think about how you plan your working lives in the future. I really hope that you will all commit to playing a massive part in this movement for change to improve things for everybody in every aspect of your lives. Have a really good evening, enjoy the presentations, and I look forward to hearing how you will come up with ideas for how we can make things different going forward for the health and for the NHS and care services. Thanks, everybody.
Thank you so much, Dr. Evans, for a fantastic opening to our event. We are now very pleased to introduce our first speaker of the evening. Dr. Nick Watts is the Chief Sustainability Officer of the NHS and leads the Greener NHS team, committing to deliver a world-class net zero emission health service. He is a medical doctor licensed in Australia and the UK and is trained in population health and public policy. Prior to joining the NHS, Dr. Watts worked internationally as Executive Director of the Lancet Countdown and the Lancet Commission on Health and Climate Change. It is now my pleasure to hand over to Dr. Nick Watts.
Thank you. Thank you very, very, very much for having me. My only regret is we couldn't meet in person. We'd have a lot of fun. Eventually, we might have some questions at the end. Eventually, we might find our way to a pub or a dinner or something like that. I wish we could do that, but there will be time for that. It's so nice. It is so exciting to be here. We just had an away day in the Greener NHS team. We've been in a bit of a sprint for the last year or so. I don't know if you've heard, the world is on fire and the NHS is going to do something about it. We've been in a bit of a sprint. At the end of the away day, we put together a little word cloud of how everyone in the team felt. The number one word I think describes how I feel every single day that I come to work and every single day I leave work: energized, excited, full of motivation, full of enthusiasm for the work that we can do, yes, but for the work that we just did. So I'm going to talk about three things: why, what, and how. I'm going to focus on that last part because the last part is the interesting part, right? Enough time on this nonsense of should we do something about it? Should we go fast? Yes, yes, faster. But the why is simple. Every day when you walk into the office, Skipton House somewhere down in South London, there's a sign there that says, hey, the purpose of the NHS, the reason we all exist here, is to deliver high quality care for all now and for future generations. No one should go and read the 6th assessment report of the Intergovernmental Panel on Climate Change. It is 7,842 pages long. It is the work of tens of thousands of scientists. No one should go and read it. But if you did go and read it, it would scare you, and you might start to think, oh my, how is the NHS going to deliver high quality care for all now and for future generations if we don't respond to climate change? And you would be asking a pretty sensible question, because it will talk to you about how just over the next 8 to 10 years, we are expecting a doubling in the number of NHS facilities on high risk floodplains. It will talk to you about how Public Health England, back when we were talking about Public Health England only a year and a half ago, discovered England's first endemic Aedes aegypti mosquito. Aedes, we all know. This particular little bugger wasn't carrying too much of any trouble, but they can carry all sorts of pretty dangerous things. Dengue fever, up until a heartbeat ago, was endemic across Europe. If you're in Australia and you're worried about vectors, you're worried about the Anopheles mosquito, and you're worried about the fact that we are now training our doctors and our nurses all across the northeast coast of Queensland to think seriously about what a fever with a slightly odd pattern might be. No longer a returned traveller, but now malaria endemic in the northeast of Australia. The IPCC report, it would talk to you about the fact that we are expecting a tripling by 2030, a tripling in the frequency of fatal heat waves. Fatal heat waves, not because of the intensity of just one day, but because they're lengthening. Because one day your hearts, your kidneys, they can stand that shift. But when it starts to shift into 3 days, 4 days, 5 days of intense heat, that's where stuff starts to give out, and that's where we start to see some of the catastrophic events we saw back only 20 years ago, 2003, with 70,000 deaths from heat wave across Western Europe. So why should the NHS care about this? It's really clear. Because we exist to deliver high quality care for all now and for future generations, and I promise you it is not possible unless we respond to climate change. The science is frighteningly clear. And when you look a little bit beneath that, you might also see that, hey, actually, we're a part of the problem. How much? 5%. 5% the NHS is responsible for. And if we were to go and look country by country at healthcare emissions, we would say the biggest emitter in the world is China. The second biggest emitter in the world is the United States. The third biggest emitter in the world is India. We might then move on to talk about Russia. And fifth, we would talk about healthcare. If healthcare was a country, it would be the 5th largest emitter in the entire world. Now, all of that is very negative. It should make us all feel very guilty, blah, blah, blah. The second reason the NHS should care about this is because we've had a decent crack at it. We have reduced our emissions by 30% over the last 10 years, 30%, and we have done so saving hundreds of millions of pounds. We have done so Whilst improving care for our patients, we've done so while delivering that high quality care for all now and for future generations. And we have done so whilst demonstrating that, God, our staff love it. Every single year, the NHS, we go out and we ask, hey, what do you care about? To all 1.4 million healthcare professionals. This is a number to remember if you ever feel a little bit lonely. Every single year, 91% in 2021, 91% of the 1.4 million healthcare professionals shout back. It is thunderous. It is terrifying. I want to work for an NHS that lives up to my values. I want to work for an employer that tackles climate change head on. I want to work for a more environmentally sustainable NHS. 91%. I don't think 91% of us agree on much at all, but apparently we all agree that the climate crisis is a health crisis. That's the why. Move on. If you take me seriously, if you take the IPCC seriously, if you take 91% of our staff seriously, and you should, what are you going to do about it? Well, the NHS has a world-beating target. It's right on the cusp of ambitious, but feasible. Right on the cusp, and that's where it should be. Net zero for the emissions we control directly by 2040. Net zero by 2045 for our full total global footprint, taking account of absolutely everything, because we are good healthcare professionals. We know that healthcare doesn't just start and stop at the four walls of a hospital. Whenever someone says net zero to you, you must also say, how big is the net in your net zero? You must never ever let anyone get away with that, because otherwise they might be getting away with lying to you. So let me be clear. 6% we currently intend to offset of our direct emissions, 8% of our indirect emissions. As best we can, we are going to reduce that down to zero, because repeat it again, the climate crisis is a health crisis. We have to start acting like it. That's the why, that's the what. How? And here I'm going to start talking about something. I haven't tried this too often, but let's see how we go. I'm not going to talk about the how for stuff that we might want to do in 2030. That's a long way away. I'm not going to talk about the stuff that we did 10 years ago or 5 years ago. We did that. Let's move on. I'm going to talk about 3 things, 4 things, maybe 5 things that the NHS has either just done or is just about to do that I think we need your help with. It's the 16th of March. 2 weeks from now, we are going to hit a deadline where we need every single trust in the country, every single integrated care system to have done 1 or 2 things. Number 1, they need to have their own net zero strategy. Number 2, they need to have a board level lead out there accountable, taking that forward. Now, I'm not going to tell you who they are, but I am going to tell you that we are in the mid-90s of all the trusts and all the ICSs who have got those board level plans. What I need from everyone in this room is to go and send an email to chiefexecutive@mytrust.nhs.net. And I need you to ask, hey, how's our green plan going on? How's that net zero strategy coming? And can I help? If they say, what net zero strategy? Shout back at them, what the hell? Nick told me to get in touch. If they say it's going great, put your hand up and say, hey, I'm a nephrologist. I'm an emergency physician. I could help. What can I do to take this problem on? That's number 1, and that's coming up. That's a really powerful deadline. It's a powerful governance mechanism for us that we are about to blast through in the next 2 weeks. Number 2, we need research and we need innovation, and God, clinicians are good at that. We have winners that we have just announced just a week or 2 ago from our first innovation competition, the first net zero innovation competition for healthcare that I know of out there in the world. We did that with SBRI and our friends at IRLS, the innovation part of the NHS. That was exciting. What I need from you guys is to go and take a look at the 2 additional calls that we have out right now with NIHR and with the MRC, looking for exactly the same thing. Hey, how can you tackle climate change? How can you tackle that within your own specialty? Apply for some of those grants. They are exciting, looking for early career researchers to help tackle this problem. The green plan, bit of innovation. We're obviously going to have to invest, aren't we? Because some of this stuff is going to have some upfront cost. I promise you this stuff is going to pay back quickly. On average, we calculate that the innovation you want to put forward for net zero, it pays for itself in just 3.5 years. Almost nothing in the NHS pays for itself in 3.5 years. It is an incredibly good investment. And so to that end, you will have seen over the last year, but you will see announced a week ago and to be announced in a week. I can trust everyone on this call, I'm sure. £6 million out to every ambulance trust in the country innovating with new zero-emission rapid response vehicles, looking particularly at mental health and how we're going to do a better job of providing care there, but we're going to do it in a zero-emission way. £223 million invested into heat decarbonisation, into the decarbonisation of our estate. Those two investments are exciting, but they only come to life if clinicians get involved. If you put your hand up and notice, hey, there's an innovation, there's an investment going on, someone is improving a ward, someone is improving a part of my hospital, put your hand up and say, hey, where did that funding come from? Did it come from the net zero team? And how can I help make sure that it maximizes the emissions reductions there? Put your hand up if you see any investment anyway and say, hey, even if it didn't come from the net zero team, how can I help? We need to make sure that we don't lock in any carbon as we go forward. So the how is a bit of governance with these net zero strategies. It's a bit of research and innovation, and anyone can apply for that. It's a bit of looking at some of those opportunities with the investment that is flowing into the NHS to take this on and saying, how can I help? Two more things. I talked about our global footprint, and we're taking on everything, 36 megatons. To put that in context, the emissions roughly the size of the entire country of Croatia or Denmark. Big, because the NHS is big. There are some things we can do nationally, and you will see on the 1st of April, we are going to introduce into every single tender out there a 10% weighting into all contracts for everything that we buy. You'll also see 2 weeks and 12 months from now that it's going to become a new qualifying criteria. We want to stop doing business with companies that are not aligned with our values. Now, we can do some of that, but to be frank, procurement is a joint decision, joint between the procurement teams of the NHS, but also between clinicians. The way that we prescribe, the way that we choose to run our care, and I need everyone to go and think seriously about how they run their care and how they can support the work that those procurement teams are going to be doing. Those are 4 things that we are doing just right now, either 1 week back or 2 weeks forward, that should give you a sense of the scale of ambition, the pace we are sprinting at this problem with. But I have one ask of you. There's plenty that we can do nationally. We can invest, like we've discussed, we can shift around with regulations, we can build some of these processes into tenders, we can run some of that governance, we can do all of that. But we can't get to net zero unless we have every single part of the healthcare system pulling in the same direction, and unless we have a diabetes nurse pulling in the same direction as an orthopedic physio, pulling in the same direction as a general surgeon, in the same direction as an asthma nurse. Unless all of us, or 1.4 million of us, are making low carbon, sustainable decisions every single day, I promise you we won't get there. And so what I actually need everyone to do is have a little bit of a think about their own clinical practice, their own work. Think about what tomorrow is going to look like, 9 a.m. tomorrow morning. Think, how could I do what I'm going to do tomorrow morning in just a tiny little bit of a slightly more sustainable way? Now, that may not seem like a lot, but if you do that and you do that a day after day after day, I promise you that's going to add up to just a ton of carbon. If all of us do that, adding up to a ton of carbon, that's adding up to 1,400 kilotons of carbon, and that is blasting through our annual reduction target. That's how we get there. We get there with GPs and asthma nurses changing their prescribing habits to lower carbon forms of inhalers. We get there with anaesthetists and emergency physicians changing the way that they think about their anesthetics, about desflurane, sevoflurane, about nitrous. We get there because we start thinking seriously about social prescribing, about asking questions of, when we prescribe that statin, do we also want to prescribe a bike? When we give someone a flu vax, do we also want to make sure that they're living in a house that, quite frankly, is properly insulated from the cold? All of those things, 1.4 million decisions every single day of every single week, month, year, is how we, the NHS, the world's best healthcare system, become the world's first net zero healthcare system. I'll stop.
Thank you so much, Dr. Watts, for that very insightful presentation. Our next speaker of the evening is Dr. Tim Ferris. Dr. Ferris is the inaugural National Director of Transformation, leading the delivery of transformation in the NHS through redesigning care services, harnessing the power of data and analytics, and building a learning health system that generates knowledge to improve population health. Dr. Ferris trained in medicine and public health at Harvard University and was most recently CEO of Mass General Physicians Organisation in Boston. We are very fortunate to have with us Dr. Tim Ferris. So over to you, Dr. Ferris.
Okay, Rada, note to self, never follow Nick Watts. Okay, because if there are people who need to go get their dinner now or something like that, because what is going to follow is just not going to be as inspirational as Nick. Nick introduced himself to me recently in the elevator at Skipton House, and let me just say, he's even more inspiring in person. And so if you do get a chance to meet him in person, please take advantage of that opportunity. So, so there's several ways I could go with this, but I did get some questions, and I'm going to try in a somewhat creative and unpre-planned way to tie my comments to some of Nick's comments. What I particularly admired about Nick's comments was the fact that he was unabashedly recruiting you, and that, like, I like, note to self, take, like, this is an important moment because I want to recruit you too, and so I'll come back to that at the end. But it's right. We should be competing for your assistance, right? And we should check and see who's got a better offer. So transformation. So transformation is it's about the big and the little, as Nick was saying. It's about the distant future, and it's about tomorrow. And it's also about change in the way we understand how we do our work. And so, having said those big dynamic tensions, let me get a little bit more specific. So you all know that since the days of Watson and Crick, that the biologic revolution, the human understanding of biology, has absolutely exploded, and the rate at which knowledge is being generated and information is being generated is extraordinary. And so Nick gave you some statistics. I have to give you some impressive statistics too. So if you took all of human knowledge up until the year 1985, so all recorded human knowledge, the NHS generates the same amount of information in 1 year. Okay, now think about the scale of that. We're talking about just, you think about the scale of all the MRIs and CT scans done in this country and stored on PACS systems, and you combine it with all the genome sequences, everything that's going on, we generate the same amount of information in 1 year that was generated through all human history up until 1985. That is, think about that from an ecosystem perspective. The management of that information has become an extraordinarily challenging task, which I just have to say is very connected to everything that Nick was saying, because while our information systems are way more efficient to generate, they are not carbon neutral, and that is something that we need to plan for and work on. So there's all that information about biology, and then there is the digital world. And so, interestingly enough, the digital world also started exploding in the late 50s, early 60s, and is now in a place that just a couple decades ago people wouldn't recognize our ability to manage this vast sum of information. And it just turns out that you have all chosen a profession, the only profession that in fact lies at the intersection of these two revolutions in human understanding. So healthcare, biologic understanding has changed everyone's lives in the world. Data and digital has changed everyone's lives in the world. But those two things intersect in medicine. And it is actually the medicine that has been actually lagging behind in using digital and data to reinvent itself. And you got to think, why is that? Why are we, where we sit at the intersection of these two revolutions in human understanding, delayed in the adoption of new ways of delivering care? And there's a lot of reasons for barriers to change. You know, there's the classic, funding and planning, but really in healthcare, probably the most fundamental reason to the delay in our adoption of new ways of working is that healthcare delivery is a really complex delivery system. And any complex self-organizing system, if you make one change to that system, it's very unlikely that change will actually manifest itself in the extent to which a single change in a linear system does. So this is a little bit of engineering speak, but just stay with me for a second. So the changes that we see, that we implement in healthcare, don't seem to have any effect on the overall delivery system. We make this little change, and I travel around on Fridays and go to different trusts and GP practices, mental health trusts, and each of them has small incremental changes. Transformation is about major change, like really completely rethinking the way you do something. And often what in a large complex organization, often what really is required for transformational change is a external stimulus that is undeniable and that is existential. And we had a pandemic, and everyone talks about how the pandemic has really changed the way the people in the health system think about what's possible, right? So it has both given us an example of major change happening really quickly that boosts people's confidence, and it has also shaken people out of their sort of day-to-day lives, a little bit like Nick just did when he asked you all to change your own carbon footprint. But here's the challenge in transforming the NHS, which is, as much as the COVID was an existential threat to this country, the NHS seems to be rapidly flipping back into its old ways of working. And that is the big challenge that is in front of us. And now I'll ask you to do something, which is don't allow this moment to pass without questioning the way we deliver care. Because right now is an extraordinary moment where we can actually rethink the way we deliver care. And we have another existential threat. It was there beforehand. We have two large existential threats. One is our capacity problems. You might have noticed the waiting list. It's just inexcusable to have hundreds of thousands of people waiting 2 years, right, for a process or a procedure or to see a physician. The other existential threat is health inequalities. And again, COVID only highlighted something that was already there. And the fact is, what we've known for a while, but is really blatantly true now, is that free at the point of care is not good enough for addressing health inequalities. It is not about equality so much as it is about equity. and what we have to do proactively to address health inequalities. And so these two big existential threats become an important lever for change, right? And so we have to address our capacity challenges. There is no way to address our capacity challenges by doing business the same way. We just have to think completely differently about how we deliver services, because there simply aren't enough people, and nor could we possibly train enough people to deliver the healthcare that we need and want for ourselves and for our loved ones without really changing the way we do things. And the same is true of addressing health inequalities. We aren't going to get there without changing our operating models. And so it's a big, it's big, difficult, and we can think of it as a distant problem. But similar to Nick's characterization, it is very present. It is very present in day-to-day work. And so we have to think about, what can we do immediately when we go to work and we're delivering healthcare, to think, could I just do this completely differently? Is there another way of doing this? And what is exciting to me, probably the most exciting thing about my job, is when I travel around the country, there are people who wake up every day thinking just that thought, like, you know what, it's time to do this differently. I'm tired of doing it this way. There needs to be a different way of delivering healthcare. I don't need to do it this way. And that's tricky in your position, because I think most of you are still in some sort of training. And so you have supervisors there. You don't have perfect freedom, but it's amazing how much your enthusiasm and willingness to engage will be infectious for those people around you, because they all know the same thing. They just haven't gotten up and made a decision to do it differently. And so that's the pitch on transformation. Think about, like, radically restructuring the way you deliver a service. And I want to just think, I'll just say that in every situation that I've encountered, and this probably isn't true in all situations, where we think about transforming a service, the carbon footprint is lower. It's amazing how that works out. I've had the good fortune of having a fellow with me who's pointed out that our home hospital program, the virtual ward home hospital program, has an extraordinary capacity to reduce the carbon footprint of taking care of sick people. Now, it has its own carbon footprint, but it turns out that all of those visits to hospitals and loved ones and the food production in the hospitals and everything we do can be done more efficiently in other places. And so there's a wonderful synergy between the transformation agenda and delivering healthcare so that it is so that we address our capacity concerns, we address the aging of the population, we address the health inequalities, and we do it in a sustainable way, and we improve the sustainability. This is a doable exercise, but it really takes commitment, and it really does take deciding when you get up to do things differently, that you're going to change a process. One of the best pieces of advice I ever got when I became a research fellow was, make sure you make progress on your research every single day. Well, the transformation equivalent of that is, what are you going to change tomorrow in the delivery of healthcare, how you deliver healthcare? A small change. It's a little bit like what Nick was asking. So I guess we're asking a lot. I, for one, get really energized by it, and I think you can too. And what's really fun is when you get energized by it and you energize other people through your energy, you pass that on. So I've talked really abstractly. I'll be really quick about a few things that we have to do in transformation. So we have to change the fact that there are 20% of acute trusts in this country don't have EPRs is absolutely unacceptable. Like, it is not okay to deliver healthcare without the advantages that computers provide us, and that's a big part of the transformation agenda. We have to find a way to use the data that's available to us electronically to improve healthcare, both from an innovation perspective and a transformation perspective. That is a widely acknowledged asset that the NHS has, but it has not yet been unlocked. We need to unlock that asset. We have to change the relationship between the NHS and the citizens of this country by making healthcare fully enabled through mobile technology. Like, we just have to do it. It's so obvious to everyone. You can book a table at a restaurant, but you can't in many places, and actually in most places in this country, you can't book an appointment with a physician, except in limited places where that functionality has been turned on. We have got to get it enabled for the whole country. And then, so these are just a few of the priorities. And then there's really exciting stuff about the use of data to actually change the trajectory of our knowledge. And I saw a really fascinating presentation last night that I want to learn a lot more of, but I was in Cambridge and I learned how a couple of fellows use data that is never used off of the back of I think you call them here a full blood count. In the US, we call them a complete blood count. It's the most common test performed worldwide in healthcare by far, over 1 billion a day, on this planet. It turns out though those machines generate an enormous amount of data in addition to the indices that we get to see as physicians. All of that data gets thrown away by the machine, but it's a very sophisticated data internal to the machine. So some mathematics fellows, PhD students at Cambridge, took that data and said, you know, I wonder if any of the things they're measuring, the 280 odd measurements that are made inside these machines, can detect whether or not there's an infection going on in that person. It turns out, using an AI algorithm generation techniques, they were able to identify infected or non-infected people from a CBC. They don't know what in the CBC is actually creating this, because that's how AI algorithms work. And they are working on the backwards, the biology of it. But imagine how transformative it would be if you could not only know if someone was infected from a CBC, but also which infection they had. And that is quite possible. So I wanted to finish on that because there's a lot of stuff we do in transformation that is just the basics, getting the basics right. And then there's the research that's built on top of that in the innovation engine, the learning health cycle, the learning health system. And then at the very top, there's defining medicine of tomorrow. We have to do all of those things, and we have to do them in a sustainable way. And the opportunities to do those things in this health system are extraordinary. So thank you very much. I'll stop there, and happy to answer any questions about net zero that Nick has trouble with.
Thank you so much, Dr. Ferris, for your fascinating insights, and I hope all of you at home are feeling very inspired by our two speakers. We are now very excited to move on to our fantastic panel of fellows who will be introducing themselves, talking a little bit about some of the work they're involved in, and posing some very interesting questions to our speakers. So over to our first fellow, Dr. Sarah Walpole.
Good evening. My name's Sarah Walpole. I'm an infectious diseases and general medicine trainee junior doctor, and I'm currently a National Medical Director's Clinical Fellow at NICE. Tim's comments about energising others really resonated with me, because when I first became interested in sustainability as an issue related to health, I explored that by talking to people around me about what might be happening or what possibilities there were to take action in that field. And from those experiences, those conversations, emerged discussion with the Centre for Sustainable Healthcare, which I've since been involved with. And then I had opportunities to work on developing education and teaching in that area. And one of the things I really learned about through that experience was the benefit of working both bottom up. So we started to implement some teaching at the medical school that I'd been at, while at the same time thinking about the top down and the big picture, like the things that Nick and Tim have been talking about. So we also did a consultation to understand what learning objectives needed to be in the curriculum about environmental sustainability, and then we went to the GMC, and now Outcomes for Graduates has learning objectives about sustainability in it. So I guess for those of us working in the health service and wondering how we can get started, I think the comments about really just talking with our colleagues and realising we need to think big, but also trying to take small steps at the start was really relevant for me. So I've got a question for Nick and Tim, which is about principles of sustainable healthcare. So to reduce carbon in the healthcare service is not only about switching to technologies that have a lower carbon impact. We also need to think about models of care and the kinds of transformation that Tim's been talking about. So that includes things like focusing more on prevention, encouraging patients to adapt their lifestyles, thinking of non-pharmaceutical interventions. It also thinks about trying to reduce interventions that don't add value. So I think one of the big challenges for us as clinicians is that there seems to be a greater perception of the risk of not doing something important than a perception of the risk of doing something that might be harmful. And I wondered whether you had any reflections on how we might address that kind of perception of risk.
Tim, this falls into the category of one of those net zero questions I might struggle with. So I think you should go first.
Yeah, exactly. Yeah. Sarah, that's a great question and a really hard one, but very important. And so I guess the first place I go when I think about questions of risk related to change is the importance of conversations. Almost always, I think that's true. When this subject is risk, which it commonly is when you're talking about changing the delivery of health services, then really good deep conversations about the implications of actions and how you will mitigate risk, like what you need to do to mitigate risk, is a really important part of the process of change. It comes up all the time in a change agenda. One of the things that I will say, though, is that frequently discussions of risk or bringing up the topic of risk it can be used as a subterfuge for or an excuse for inaction. And so one of the things that is important that I think about is to really delve into the risk conversation in detail, because it often turns out that in a risk conversation you're arguing against, or you are reasoning against there's no counterfactual. The counterfactual is the status quo, and the status quo is never free of risk. And so that's an important way to frame objections that are based on risk, which is what's the counterfactual, and is the counterfactual risk free? Is the status quo risk free? And that's often not a place where people go in these conversations. I hope that was, Sarah, I'm not sure that was responsive.
Thank you, Tim. I think that was really helpful, and I think it's going to be a interesting challenge that we'll continue to think about going forward. So thank you very much. I'm going to pass on to Manraj for the next question.
Great, thanks. Thanks, Sarah. So I'm Manraj. I'm one of the Chief Sustainability Officer's Clinical Fellows. So I get the pleasure of working with Nick and taking some of his passion and enthusiasm for this. So I'm a urologist by background, and I guess what brought me to taking a year out to do something I'm really passionate about is coming from a similar state that Sarah mentioned, sort of thinking about health inequalities, how we can improve access to care, tackle those sort of wider structural determinants of health, and then coming across the inequity of healthcare, that those that have contributed the least will be most affected. And I spent some time working within global health, and then came back to the NHS and had that epiphany moment of, wait, we are part of that problem, that sort of fifth emitter if we were a health sector like Nick mentioned. And then thought I really should do something about this, and what can I do? And it all felt a bit too much and overwhelming, especially in surgery. And I think there's been lots of comments around single-use plastics and how we tackle that. And then coming around to the idea that actually there's a huge opportunity here, a real chance to start to think about, like what Tim said, about thinking about the way we look after our patients and how we can change that in a way that is more sustainable and is better for our patients. And that came from the co-benefits that come from living an active lifestyle or a healthier lifestyle, you know, tackling cardiovascular disease, respiratory disease and diabetes. But looking at surgery specifically, it's more those ways that we can deliver more efficient and effective care and start to look at things through a green lens. And that's some of the work that I've been doing with the Greener NHS team, is looking at that low carbon model of care and how it's actually quite good for our patients, and it can be a way to deliver that high quality care. I guess my question is to you, Tim, is thinking about that transformation, thinking about how we're going to change how we deliver care moving forward, especially after COVID, and hopefully banking on some of those wins that we've seen and this opportunity for change. Is I've heard you mention your 10 key priorities, which I think you touched on a little bit with regards to EPR. I guess my challenge is, how do we embed sustainability within those priorities, and where does sustainability sit within that? And is there a chance for your work to really be an exemplar of how to innovate high quality, low carbon care and demonstrate that sustainability is sort of business as usual and part of this rather than a siloed issue?
Manraj, that's a great question, and I'll just tell you, I think about it sort of the same way I think about inequalities, which is it cuts across everything. Like it should be part of our thinking in everything we're doing. And I'll just tell you, that is a challenge for me. It's not the first thing I think of. It's been super helpful for me to have Becky with me, because Becky helps remind me that, you know, that to keep this on the agenda. But I think of it, and I have the same issue. I just think every time we are planning, if you have a checkbox for how you make a plan, any transformation plan, that checkbox should include, have you thought about sustainability impact and maximized the potential there? Have you thought about inequalities and the potential of what you're doing to exacerbate them or ameliorate them? And what are you doing? It should be part of every planning process and every implementation process. And one way to make sure that happens is to measure it. And I find measurement really, really important, that if you're measuring it, you're paying attention to it. If you're not measuring it, you probably aren't paying attention to it. Well, I guess if you're measuring it, you at least have the chance of paying attention to it. So it's necessary, but not sufficient, but it is necessary. And so measurement is a really important issue, both in sustainability and in inequalities.
Great. Thanks so much. I was just going to mention there's lots of questions in the chat about what trainees can do, and I just wanted to when you mention measurement, is to try and use some of this work to embed it in your tick boxes. There's lots of questions around tick boxes and the pressures of being a trainee, and I'd say from my experiences, try and use this in those audits, quality improvement projects, and lots of the other stuff that goes on alongside your training, and make it sort of valuable as part of that. So I'll hand over to Kieran, who's next up.
Yeah, thanks, Manraj. So I'm Kieran. I'm another one of the National Medical Directors Clinical Fellows, and I'm currently working for Greener NHS on my fellowship. And I'd say, as someone who's relatively new to working in this kind of health and sustainability space, I've probably done a lot of thinking about my why, and Nick touched a lot about you know, the responsibility I think we have within healthcare to actually take action and to think about the holistic view of health and what potential harm we're doing. And I think that really is a big part of why I've made the link between, you know, climate change being important and it being something we need to act on as society, versus when I go to work every day, actually, this is something I need to do something about at work. But I think the other part of it, and Tim sort of alluded to this, is when you really start thinking about what a net zero healthcare or a sustainable healthcare system actually looks like, the kind of things you end up coming up with are a system that's, you know, integrated, joined up, fair, equitable, things like that. So it's actually all the things that, even if you never even thought about carbon, we would probably be aiming for anyway, give or take. But broadly, the things that tend to be good for reducing emissions, carbon emissions, are also good for patients, and usually they can save money, at least in the long term as well. And I think so. Some of the work I've been doing with Greener NHS is all about medicines and inhalers, and that's kind of a good illustration about that, because I think if you can switch to good respiratory care and get everyone doing the right things, then it's really good for patients, and it's actually the sustainability aspect brings a really strong driver to make that change, which maybe wouldn't have been possible otherwise. And I think I agree that the really important thing now is taking action. The argument's been made, and I think, you know, different people have heard it in different degrees, and you may need to go back to it, but actually taking action is the best way to do something, but also to continue making the argument and telling people about it. And especially for this group, I think trainees really are the lifeblood of innovation and change in the NHS, because we move around a lot. We come with fresh ideas, you know, fresh eyes on things. So I'd really echo the views of what everyone said today in terms of getting involved. I'll ask a question to Nick, because he hasn't spoken for a while. Nick, I think, so you mentioned about 2045 and those kind of ambitions being really far in the future, which I agree, it's sometimes difficult to think about that. And you've also talked about what we're doing now. But I just want to ask about the sort of midterm. So in terms of trying to paint a picture for everyone listening of what, let's say in 5 to 10 years, what a sustainable or a net zero healthcare system would look like. What kind of changes might we see if we're meeting our ambitions? And in particular, what ways do you think the roles of clinicians may have changed to contribute to that?
Good question. So listen, it's good. It's a good thing that Tim is here, and it's a good thing that Tim is good at his job, because I'm going to rely on him to deliver most of what we need for a net zero healthcare system. Tim, virtual wards, digital transformation, tackling those health inequalities. I promise you, I can't get the NHS to net zero unless you're doing all of that stuff alongside us, because I challenge you, I challenge anyone to try to find an area where we might disagree, where they don't overlap. We are pulling in the same goddamn direction. So I need to see all of that. I need to see us not fall back into the same patterns we did in 2019. Critical, in fact, to the assumptions that underpin our net zero ambitions are that this digital transformation is successful and exceeds our expectations. We are the biggest cheerleaders for this work. We are the biggest cheerleaders you could possibly imagine for a more expansive healthcare system that understands its role within a community, that understands the importance of those broader determinants, its ability to invest locally, right? And how does that relate to climate change? Well, I've just talked about a whole bunch of things in digital transformation that I promise you, if we get right, will reduce the emissions of the NHS. 18% of our emissions are related to transport. Reduce the emissions an enormous amount because we will stop moving people unnecessarily back and forth in a way that, quite frankly, is a barrier to their access to healthcare. If we invest locally in the communities that we are present in, and we're present everywhere, number one, you're going to do a heck of a lot of good stuff to improve those broader determinants. But number two, you are going to start procuring locally. You're going to start to move away from taking in, I don't know, whatever on earth we buy from Perth, Western Australia. I bet you it's something. I bet you we don't need to buy it from Perth, Western Australia. I bet you someone makes it better somewhere closer to home. I bet you the food here, buying from local British farmers, is better if we buy it here. And I promise you it will be good for sustainability. It will be good for our bottom line. It'll be good for that local community. So I need to see all of those things. I need to see us tackle that. I need to see us tackle health inequalities. 36,000 deaths every single year from outdoor air pollution. Unacceptable when you understand that the vast majority of those are experienced by those deaths are experienced by the vast majority of those are among people that are the least responsible. How do you tackle the air pollution problem in this country? You do three things. You decarbonize transport, you decarbonize the power sector, and you decarbonize the residential sector. Those are the three things you have to do if you want to tackle that health inequality priority. The overlap is almost 100%. 5 years from now, I want to make sure that we are the world's first healthcare system with the world's first net zero hospital. We have a net zero hospital standard coming out in a heartbeat. It's going to be really cool. It's going to be a really exciting new thing. I want people to go and look at us. I want the New Zealanders to go and look at us and say, God, that's great. Look at that hospital. Look at how it understands its role in a broader community. Look at how it understands that it has a responsibility for things outside of the four walls of a clinic. We're going to be the world's first healthcare system to have not just one, not just two, like we already do, net zero ambulances, but a fleet of net zero ambulances. 12 months from now, we're going to publish a new national specification. The NHS is going to stop buying, because we just don't need them, because they are bad for the health of our patients, diesel ambulances. The air pollution is terrible. We don't need it. And so we're going to have a fleet of net zero ambulances. It is all of those things and everything else you can possibly imagine. That's the impossible, ambitious, exciting thing about taking on the delivery of a net zero healthcare system. You have to do the first 10 things you can think of, the next 10 things, the 20 things after that, and the 500 things after that, because this is a transformation that doesn't just tinker around the edges. It redefines what it means to be a doctor. It redefines what it means to be a healthcare professional. It redefines what it means to be the world's best healthcare system. How's that, Kieran? Bit of platitude.
Perfect.
Thank you so much, Dr. Watts. So we've come to the end of our Q&A session, and unfortunately we've run out of time to answer any more questions this evening. We've had some excellent questions posed by our audience today, and hopefully some of these have been answered throughout the webinar and in the chat. Thank you to our panel and speakers for some really thought-provoking questions and some excellent answers. Over to you, Venetia.
Thank you, Radha. It has been a pleasure for us to host this event. Thank you to everyone for attending, and a big thank you to our speakers and panel for giving up their spare time. We hope you found this session useful and informative, and we are now very pleased to hand over to Professor Wendy Reid to close the event.
Thank you. Thanks very much, Venetia, and thank you to everyone. I have the privilege of being the sponsor for the National Trainee Engagement Forum, and I just am blown away by, first of all, how brave they are, but how they get such great speakers. I'm very jealous. But Nick and Tim, thank you for setting the scene so passionately. But I just want to go back to what Navina said at the very beginning as a message to everyone on the call. She said you have power, and I agree, you have power and agency. And I think you've had the offer, and indeed you've got a competitive offer from Tim and Nick as to who you want to follow. But it strikes me that what we heard is that the commonality between all of our jobs is underpinned by our massive responsibility for environmental change. It's part of everything we should do. And I love the idea of waking up every morning and thinking how I'm going to do something myself. Really hard to follow, but a really great challenge. So as well as the personal, you're part of a really complex system, the NHS, you're part of a training system, and I recognise the tick boxes, and no matter how hard we fight against them, they always reappear. However, how about you come to us and say, what would you like to see in recruitment that shows that we value your work in terms of improving the environment? We can give you points for all sorts of things. At the moment, you get a point for writing a paper on the big left toe or whatever it might be. How about we actually value this in a really specific way that says you are going to be part of our system in the future because you are showing the values and the actions that we want to take. And for those of you that are perhaps less sure, or perhaps in a situation where you are learning so much that actually taking action is hard, keep making the argument. That's the very least we can all do, is to keep speaking up and keep making the argument. I rely on the clinical fellows around me, so Radha and Venetia, to tell me what we should be doing. Our generation, with respect, haven't done terribly well in this space. It's very new for us. You're the generation that are going to change things. And I think our job, particularly in leadership roles, is to make that possible for you. So please come back through the forum, send us ideas. You know, we can make things happen. So do that for us, and go on with the forum having the most extraordinary speakers. I'm really impressed, and thank you very much to everyone.